Good afternoon. I want to thank everyone for joining us today. As we've been through this evolution over the course of the last year, this is one of the first times I feel like we're coming to you with a series of things that are generally good news. We are making considerable progress in our fight against COVID-19. Now, we remain very cautious and we continue to reiterate with the public, despite the progress we're making, we have to continue to do the things we've been doing, wearing masks, avoiding high-risk settings, physically distanced from non-household members. The success we're having is not in spite of those efforts, but because of those efforts, and we want to see that continued progress. But as we come before you today, our case counts are down significantly. You have to go back to last fall to see individual days with case counts as low as we've had, along with percentages of positives. Our hospitalizations are going down. And even with the interruptions in the last few weeks in the availability and supply of vaccines, we are getting vaccines in arms at a very impressive rate. Today, we are reporting more than 783,000 vaccines administered, which means that 1 in 5 San Diegans, 20% of San Diegans, have received at least that initial first dose. We have almost 68% of our seniors have been vaccinated. All of our long-term care and skilled nursing facilities have received at least their first vaccine. And we are making considerable progress. We see the progress around youth sports. We're incredibly encouraged by recent news by school districts that are planning and preparing and getting ready to open, some as early as the beginning of April. And we know that we are descending through the tiers and are looking forward to, in the coming weeks, if we can keep this trajectory going, the prospects and possibility of descending into that red tier. And so this is all encouraging, and San Diegans should be commended for the position we're in. But again, we want to keep it going. We don't want to lose our focus. We don't want to lose our vigilance, and so we want to continue to see the progress. But a part of this progress and a next step that we're preparing to take is to move into the next tier or next group of those eligible to receive the vaccine. We begin to see some slack in the first dose appointment utilization by our seniors, and so we're prepared starting this weekend on Saturday to open up vaccinations to our school and child care sectors, our education and child care sectors, our non-medical emergency responders, and our food and agriculture sectors. Now, I want to caution that when we do this and we take this next step, we will be opening up vaccines to about 500,000 San Diegans. Between these three tiers, there's about 500,000 folks that fall into these three buckets. There will not be 500,000 appointments available on Saturday, or Sunday, or Monday, or for many weeks coming forward. And so we need folks to be patient. We're not seeing all of the first dosages utilized by our seniors, and so we're ready to move to this next tier. We think we'll be ready to go. We know we'll be ready to go on Saturday instead of Monday, which was the previous plan. But there's going to be considerable strain on the vaccination system and on the appointment system. And so we need folks to understand that as supplies increase, and we do feel confident, particularly in the first and second week of March, that we will see increased supplies of vaccines, which will allow us to make more appointments available. But as we move into this tier, again, we just want to reiterate and encourage San Diegans and let them know as soon as we get vaccines, we make appointments available, and likely as soon as we make them available for the next week or 2 weeks, they will probably be immediately gone. And so we will fight to get as many as we can. When we get them, we'll make them available. But we just want to have a word of caution that not everyone in these three tiers is going to be able to get an appointment immediately. It is going to take a little bit. I also wanted to share some of the work we've done, starting with our schools, with our K through 12 schools. We all want to get our kids back in class, and we know that for a number of districts that is dependent upon getting the vaccine, and so we want to get those vaccines to our K through 12 personnel. We want to do it as rapidly as we possibly can. We've been working closely with the San Diego County Office of Education, and Dr. Paul Gothold is here if anyone has questions, and we appreciate Dr. Gothold and his staff. They've been working in partnership with VIBA, and between VIBA and the San Diego County Office of Education, we're creating essentially a closed system for K through 12 school personnel, both teachers and school staff. This system will be run and administered by VIBA in partnership with San Diego County Office of Education, and we as a county will be setting aside not the 10% that the state said should go to K through 12, but 20% to try to get our teachers and our school staff vaccinated as quickly as possible to help facilitate reopening and getting all of our kids back in school. The way it will work is essentially County Office of Ed will look at those school districts that are open or have a plan to open pending vaccination. They will put those in the queue, and they will prioritize those based on zip code, meaning the communities that have been hardest hit by COVID and the school districts in the communities hardest hit by COVID will have priority access, but the aim is to move swiftly through our teacher and school staff personnel so that we can get them open. They will have a website, vibavaccines.com, that has information, but it's really important for our K through 12 community to know you can't go get an appointment. They're going to work with the schools and with the districts, and they will schedule them that way. That website, vibavaccines.com, allows people to sign up for alerts and information. But for K through 12 communities, your school and your district will be contacted by the County Office of Ed and by VIBA in order to schedule and facilitate that appointment. It won't go through our normal public network or My Turn or Vaccination Superstation. We've built a closed system, and we're going to prioritize, again, 20%. If we can do more, we will, to go into those school personnel to get them, and that's how we will be handling K through 12 vaccinations for teachers and staff. And again, we greatly appreciate Dr. Gothold and the County Office of Education and VIBA, along with all of the school districts throughout San Diego County. And we need to be patient as they get this up and running. There's going to be some tweaks and some bumps and some things they have to do, but our goal is to, as swiftly as possible, get those folks vaccinated. If you are in the education and child care sector, but you are not related to K through 12, your community college or higher education or child care, then you will go to vaccinationsuperstationsd.com, and you can go to any of the pods that we have available and work to get an appointment through that. For non-medical emergency service workers, those folks can also go to Vaccination Superstation SD and access any appointment at any one of our sites. And Scripps Health has volunteered to step forward and help us vaccinating, in particular, our law enforcement personnel. Scripps Health will be working with each of those agencies to schedule those and get those folks in and vaccinated again, starting as early as Saturday morning. But anyone in that tier, non-medical emergency service workers, can go to the county website and work to get appointments that are there. And then our food and agriculture sector, which is nearly 400,000 workers across our county, those individuals can also go to Vaccination Superstation SD and go to any of our sites that are out there and available. We are working in particular with our grocery stores and pharmacies about how we can provide some additional allocations so they can vaccinate their own workforce on site, which we think will be more convenient and easier for them. But again, we are excited to take this step forward. We ask for everyone's patience. K through 12 teachers, staff, school personnel will go through the County Office of Ed and VIBA. They will be scheduling, they will be administering, those will be beginning Saturday. They will take schools open or with a plan to reopen, and they will try to prioritize those districts as best they can by zip codes, with the hardest hit communities getting priority, and they will be scheduling those directly with the districts. Folks can go to that website to sign up for more information. If you are not K through 12 but education and child care, you go to the county website, sign up for an appointment, and show up. Non-medical emergency service workers, you can go to the county website and sign up with appointments starting Saturday. And food and ag, you also can go to the county website and sign up. Our CAL FIRE teams for food and ag will be going into the fields to vaccinate our farm workers and trying to reach those communities which are hardest to hit. And again, just reiterating once more, the slack in appointments will be gone starting Saturday morning. They will go very quickly. And so we just encourage everyone to be patient as we move forward. We will continue. I mentioned we vaccinated about 68% of our seniors. We will continue to make all of our sites available to seniors. About 165,000 remain. And our efforts around dedicated sites for our community health workers reaching hard-to-reach communities, they will still have priority access into vaccine appointments, along with 211 for seniors who don't have technology. They will have access into vaccines, and we will, of course, continue to prioritize second dosages moving forward. So a lot of forward progress as it relates to vaccines, and we're encouraged about where we're headed. When it comes to youth sports, obviously the state put out revised guidance that we think is appropriate at this time with the improving conditions we're facing. The cutoff is you can resume competitive play for outdoor youth sports when you hit a case rate of 14 per 100,000. We barely missed it this week. We were at 15. We have a high degree of confidence that next week we will be at 14. All of the youth sports can resume non-contact practices now. And if we hit 14 or lower next week, then they can resume competitive play and contact sports. And so we're encouraged about the prospects there, and I know everyone is looking forward to that. And then we will continue to monitor our progress in terms of descending into a lower tier and moving in and having more things reopen. So in general, case numbers are good. We need to keep that going by doing the things we've been doing to get them low. Vaccines continue to be administered, and we have some optimism that the supply of vaccines is going to increase significantly, particularly as we get into March. And we've continued to build out our infrastructure with more super stations and more pods to be able to, when that supply significantly increases, to be able to, with the flip of a switch, provide more appointments and be able to provide more vaccines. So we're very encouraged by where we're going. Again, special appreciation and thank you to Dr. Paul Gothold, to VIBA for their help on K through 12, and to Scripps Health for their help on our law enforcement personnel. With that, let's jump into our charts for today. Here you just see a quick map of all of the sites, vaccination sites and locations that are out there that you can see on there, both the super stations and the pod. Again, we're trying to place these in the communities that have been hardest hit and most impacted, and continue to build out the infrastructure. Even though we haven't had the supply to support it, we want to build out the infrastructure so that when the supply increases, we are ready to go. Next chart here is just a quick run through. Right now, we're still doing healthcare personnel, long-term care facility, staff and residents, and those 65 and older. But starting Saturday, we will open appointments to emergency services, education and child care, and food and agriculture. And it will take us a little bit of time to work through this group, but we are excited to do that. And then, of course, on March 15th, we will be opening for folks with underlying health conditions. And so we've got a few weeks before we hit that point, but that will also be coming March 15th. Next slide. Here you just see law enforcement service sector. Law enforcement only is being aided and assisted by Scripps Health. K through 12, TK through 12 only is being administered by San Diego County Office of Education in partnership with VIBA. And our food and agriculture sectors for farm worker is being handled by Operation Collaboration and CAL FIRE, which will be going into the field to do that. Every other group will be able to access our public portal and our public listing of sites dispersed throughout San Diego County. Next chart. Here again, you just see our T3 numbers. Again, testing coming down, generally just less demand for testing. The supply remains there, but you see that there. Next. Here you have our number of cases. There you see there, again, we remain low. The percentage of positive is 4, and that purple line is descending and trending down. And you see the number of cases, again, kind of bouncing a little bit up and down, but again, staying remarkably low compared to where we have been. Next. Here again, hospital census descending, both COVID ICU and COVID-related hospitalizations. This is encouraging. This obviously follows a lag in the number of cases coming down. And ICU capacity, again, you see the number of COVID numbers coming down. Hospital systems continue to catch up non-COVID related ICU utilization, but again, encouraging trends with more ICU beds staffed and available on a regular basis. Next. Fortunate loss of life yesterday, 29, today 12. We're now at 3,230 San Diegans who have lost their life from COVID-19. And this is just where we are in the tiers. Again, you see that adjusted case rate at 15. We are descending rapidly and moving quickly. We hope that this gets 14 or lower next week for youth sports, and we will continue on our progress towards the red tier.